If you or a loved one is living with cancer, you probably have two focal points: how to rid yourself of it and how to prevent it from coming back. You'll get some terrific information today on Cancer Concepts and Complements with Dr. James Belanger. We'll explore natural medicines which may enhance conventional therapies, share cutting-edge research, and offer insight on how diet and natural medicines can play an important role in treating and preventing cancer. The information presented herein is in no way intended as a substitute for medical counseling. Now, here is Dr. James Belanger.
Hello, everyone. Welcome back to Cancer Concepts and Complements. I'm your host, Dr. James Belanger from the Lexington Natural Health Center in Massachusetts. I have an exciting show for you all today. I think you're going to find it useful if you happen to have breast cancer, or you have a family history of breast cancer, or a loved one that has breast cancer. So today I'm going to talk about breast cancer, mostly a little bit of uterine and ovarian cancer, talking about the mechanisms of resistance to hormonal therapies, drugs such as Tamoxifen and drugs called aromatase inhibitors like Arimidex and Femara and Aromasin. To talk about natural medicines that may overcome resistant mechanisms, allowing those drugs to work better and longer. And then I'm also going to talk about some natural medicines and dietary therapies that can affect estrogen itself, estrogen levels, or estrogen signaling pathways, the pathway in the breast cancer cells that eventually leads to growth from the estrogen, and also affect the metabolism of estrogen, the breakdown of estrogen in the liver and in the bowel. But first, let me give you a definition of what hormonal therapies are. A hormonal therapy, by definition, is either a drug that blocks estrogen receptors, thereby competing with the woman's own estrogen. And those drugs include Tamoxifen is the main one, and another drug called Raloxifene or Avista. And then there is drugs called aromatase inhibitors that block the production of estrogen. Estrogen is produced in the ovaries in women that are premenopausal and in the fat tissue of postmenopausal and premenopausal women. And it's also produced, you'll learn, around the cancer itself. And aromatase inhibitors decrease the production of estrogen. They don't block estrogen like the Tamoxifen drug does. It just lowers the production. So that's what I mean by hormonal therapies, either drugs that block estrogen or drugs that reduce the production of estrogen. And then there's also natural medicines that can work like that as well. So these drugs are used clinically for breast cancer mainly to help reduce risks of reoccurrences in women after surgery, chemo, and radiation. And they're also used to treat metastatic breast cancer. They're also used for uterine cancer, which is estrogen sensitive as well, to prevent reoccurrences or to treat metastatic uterine cancer. And then sometimes you'll see aromatase inhibitors used in ovarian cancer, recurrent ovarian cancer, one that came back after surgery and after using chemo like carboplatin and Taxol. Sometimes they give it a go and try an aromatase inhibitor and see. It doesn't work too well for ovarian cancer, but it can be useful in some women. So this will apply to that, what I'm going to talk about today, because we're going to talk about ways to enhance the aromatase inhibitors. If it happens to work for ovarian cancer, then we want to keep it working as long as possible. So there's two major groups. We got Tamoxifen, which blocks estrogen receptors, is one group, and it's being used to treat premenopausal women right now as a preventative agent to prevent reoccurrences. So after a woman has surgery and radiation and has the chemotherapy, Tamoxifen is given for 5 years after that in premenopausal women to block the estrogen that she has, to help prevent it from stimulating any cancer cell that was not removed or destroyed by chemo and radiation. And so it's been really helpful for that. And then aromatase inhibitors are primarily used in women that are postmenopausal to help prevent a reoccurrence after surgery, radiation, and or chemotherapy. And the reason why aromatase inhibitors are for postmenopausal is because they reduce the production of estrogen, but they don't appear to be powerful enough to reduce the estrogen that a premenopausal woman has. She has just too much estrogen, so they use aromatase inhibitors only in postmenopausal, unless a woman with premenopause is put into menopause by having her ovaries removed, or having her pituitary shut down by a drug called Lupron. So they have drugs that can induce menopause in premenopausal women, and then aromatase inhibitors can be used to reduce what's left, because estrogen is produced also in fat tissue. So even if the ovaries are removed or shut down with this drug Lupron, a woman that's postmenopausal or induced menopause still produces estrogen in the fat tissue, and aromatase inhibitors are good for decreasing that a little bit of estrogen that's still being produced. So yes, estrogen is produced in the ovaries, primarily in premenopausal women, and it's produced in fat tissue. We have these glands called adrenal glands, and they produce these hormones called androgens. Like testosterone, for example, is an androgen. It's not produced in the adrenal glands, but it's an androgen. But there's these other androgen compounds. Like you might have heard of something called DHEA and stuff. Well, some of these androgens go to fat tissue, if you have some fat tissue, and it's converted into estrogen in both a premenopausal and postmenopausal woman. And that's why often women that have more weight on their body are less likely to get hot flashes as they go through menopause, because they have some fat that's producing that little bit of estrogen. But that also makes you at a higher risk sometimes for breast cancer when you have more fat tissue. So it's kind of has pluses and minuses in that way. But it is produced by fat tissue. And 70 to 80% of all breast cancers are estrogen positive. So they express the estrogen receptor. So they have like binding sites, like docking sites for estrogen. And estrogen helps them grow, helps them make more DNA, helps them replicate themselves and divide in half. 70 to 80%. And mostly in the women that are postmenopausal. There are what's called estrogen-negative breast cancers, which are more common in premenopausal women. But today we're going to focus on estrogen-positive because it is the primary group right there. So estrogen is produced in the ovaries. It's produced in fat tissue, but it's also produced by the cells that surround the cancer. In some previous shows, I've been talking about what's called the stroma. It's the area that surrounds cancer cells. And I mentioned that it's made up of cells, certain cells called inflammatory cells and suppressor cells. So we have these cells that surround the cancer, and they act like guards. I talked how they can suppress our immune system and protect it. They can also secrete growth factors for cancer cells to help it grow. So it's got its own little set of guards and cooks, you could call it, that help feed it and supply it. It's also surrounded by these other cells called fibroblasts. Fibroblasts are cells that make up connective tissue, just supportive structures that help support an organ. So breast tissue or any tissue always has these fibroblasts, these cells that make supportive structures. And so there are these fibroblasts that surround cancer cells. They're called cancer-associated fibroblasts, or CAFs, that actually can be induced to produce estrogen. And they're induced by inflammatory cells, the guards that surround the cancer. So these inflammatory cells, they call them M2 macrophages and neutrophils that collect around the cancer because the cancer brings them in. They cause these fibroblast cells to start making estrogen. And it's been reported that sometimes the concentrations of estrogen around a breast tumor or a tumor, that's estrogen sensitive, even a uterine cancer tumor, maybe have 10 times more estrogen around it than in the blood. So it's producing 10 times more than is being produced in the fat tissue or by the ovaries, and that's what's circulating in the blood. So all the estrogen being produced by the fat tissue and by ovaries circulates in the blood and travels to the cancer that way. But then the cancer starts to make its own estrogen locally, 10 times higher amount than what's being supplied by the blood. And that's what makes it often more difficult to lower the estrogen in that way because it's starting to make its own. There's also fat cells in the breast tissue called breast-associated adipose fibroblasts, or BAFs. Adipose means fat. So fat cells in the breast that are also turned on by these inflammatory cells to produce estrogen. And so the estrogen that's being produced, whether it's being produced in the fat tissue, the ovaries, or by these fibroblasts and fat cells surrounding the cancer, the estrogen diffuses into the cancer cells, binds to these receptors. So just think of it as like a boat coming into a dock. Estrogen's a boat coming in, and it binds to a dock, and it unloads its cargo. And that leads to some change in the cell, which basically leads to stimulation of growth, replication of the DNA, and more cancer cells if the cancer cell has estrogen receptors, which 70 to 80% of breast cancer cells express lots of estrogen receptors. And so that leads to growth. And it can go through like two pathways. Basically, as the estrogen diffuses into the cancer cell, it binds to these estrogen receptors inside, and then that complex, that estrogen receptor complex, goes into the DNA, or the nucleus of the cell, and binds to genes. And genes start turning on replication pathways, and that leads to the replication, reproduction of the cancer cells. But it can also go to another pathway. We have, think of a cell has all these docking sites. So think of it as like a port, and like I said, all these docks and all these boats coming in. And one of those boats is estrogen, and it's docking itself. But then there's also other boats coming in, other growth factors, they call it, like HER2, EGF, epidermal growth factor, or insulin growth factor, or fibroblastic growth factor. They're basically all these growth factors that are coming in from the blood and in the surrounding cells that bind to docking sites on the cancer. Well, there's some crosstalk that happens between the estrogen receptor and these other growth pathways, just like a port that has all kinds of docking sites for all different boats. And, as they get off, there's some crosstalk between them, maybe some intermingling and sharing of the goods. So this EGF and this insulin growth factor and these other growth factors all talk with the estrogen signaling pathway. And that, basically amplifies the whole signal that way. And that's going to be important when I talk about resistance mechanisms. So, but let's back up to, so tamoxifen is good. We definitely want, I support tamoxifen and aromatase inhibitors because they have been studied a lot and been shown to help reduce risks of reoccurrences and can help treat metastatic disease as well. Tamoxifen, the results, women take it for 5 years on average. And they've done studies for up to 15 years later showing that it can reduce the risk of getting a reoccurrence by not as high as you would think, 12%, but after 15 years, and the risk of dying from breast cancer by 9%. But it has been studied for a long time. Not a huge number, but if it's tolerated, it can reduce by 12% a risk of reoccurrence. The aromatase inhibitors have been also studied and been shown to help reduce risks of reoccurrences. And they're also good for treating metastatic estrogen-positive breast cancer. So when it spreads to the bones and the lymph nodes and the lungs, for example, there's a study done in the journal Clinical Oncology in 2000 showing they compared the aromatase inhibitor Arimidex with tamoxifen, showing that there was a slightly better response rate. 21% of the women responded to the aromatase inhibitor versus 17% with tamoxifen. And then the drug lasts about 11 months before it starts to progress. And so we definitely want to improve on that. I'm going to talk about some natural things. I've seen women go years and years without reoccurrences with aromatase inhibitors combined with natural medicines. But the data says that about 20% of the women respond to an aromatase inhibitor, and it lasts about 11 months. And then when it fails, then they often try another aromatase inhibitor called Aromasin. Aromasin is a different generation of aromatase inhibitor, and it is often used when Arimidex or Femara, the aromatase inhibitors, don't work anymore. And it usually only works for an additional 4 months. And after that, it's chemotherapy, long time use of chemotherapies. And chemotherapy, of course, is associated with, could have a lot of side effects. So, my goal here to talk to you today is to review the research of natural things that can start to make these drugs work better. These drugs are helpful, but if we can make them work more than 11 months or have a better response rates than 20%, then that would be important. And there are some natural medicines that are looking some really promising. So why do these drugs only work for a typical year or so, and why does Aromatase only last 4 months after there's a resistance to Arimidex and Femara? It's because of resistant mechanisms can develop. And I'm going to give you a little analogy to help you understand how this happens. So think of the cells that surround the breast cancer, which are called the fibroblasts. So we have those cancer-associated fibroblasts, and then the adipose fibroblasts, they're called. But they're surrounding the cancer, and they're protecting it, and they are making that estrogen. And so it's like a factory going on right there. And they're supplying the cancer cell with these different compounds, including the estrogen. And so that's their product, is estrogen. So think of it as a factory going on. And they're getting a continuous supply of the hormones they need from the ovaries and from the fat tissue, and the factory is happy. So it's getting its key component, estrogen. But then in comes the tamoxifen, or in comes the aromatase inhibitor. And now all of a sudden their supply is decreased or blocked. So like if estrogen is on a truck and it's coming towards the factory, now there's a roadblock set up and the estrogen isn't getting there. Tamoxifen created that roadblock. Or there's a problem at that supply center and the estrogen levels are being decreased. That's what the aromatase inhibitors affect. And so it's not getting its supply. The factory is no longer getting its supply. And that's some analogy you can think of. So we're going to have to take a break right now, and I'm going to talk about some more resistant mechanisms to aromatase inhibitors and tamoxifen. This is Cancer Concepts and Compliments. I'm your host, Dr. James Belanger.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hello, everyone. Welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger. Before the break, I was giving you an analogy to help you understand some of the resistant mechanisms to aromatase inhibitors and tamoxifen. And so I want you to think about that basically the cells that are around the breast cancer are like factories. And the tumor itself is a factory. And what's the end product of the factory? Are more breast cancer cells. That's their product, more and more breast cancer cells. And that factory is getting a lot of deliveries coming in, a lot of growth factors I talked about are coming in and getting supplies and making a lot of its supplies of things that it needs. But a key component, if it's an estrogen-positive breast cancer, is estrogen. That's a key component, and it's fine because it's getting a continuous supply of estrogen, either from the ovaries, if it's a woman that's premenopausal, or from the fat tissue in women that are postmenopausal. So it's getting this continuous supply, and it's happy, and it's producing more and more breast cancer cells. But then in comes the hormonal therapies. The tamoxifen is like the roadblock. It is the thing that is shutting, blocking all the roads so that the estrogen can't even get to the factory. And then the aromatase inhibitors are preventing the supplier from keeping up with the demand and supplying the necessary estrogen to the factory. And so I mentioned too, what do you, if you're a factory owner, what are you going to do if all of a sudden your main ingredient starts to decline? That supplier, like say you're making, I'll give you an analogy, like chicken broth or something, and you're a factory and you're making chicken broth. You got the onions, you got the carrots, you got the celery, you got all the spices, you got everything you need, but you don't have the chickens. So you rely on another supplier to give you those chickens, and that chickens is the estrogen, okay? And so there's a roadblock, and you're not getting those chickens that you need. So what are you going to do? Well, you're going to start producing the chickens on site. You're going to set up a chicken farm right there on your factory and start making the chickens because that's what you need. And forget the supplier, the outsourcing the chickens anymore. And that's what, like I mentioned, breast cancer will do. The cells that are around the breast cancer start producing the estrogen that they need, and even maybe breast cancer cells themselves start to produce it. But 10 times more estrogen at the site of a cancer than in the blood. That's how much more estrogen it will start to produce. And it is the inflammatory cells that start surrounding the cancer that induce this whole process. There's cells that are white blood cells. Macrophages are the names, M2 macrophages they're called, and neutrophils. They're inflammatory cells that start producing these compounds called inflammatory cytokines and something called PGE2 and something called oncostatin M. But they're just compounds, inflammatory compounds, that actually start to stimulate these fibroblasts that are surrounding the cancer to start producing estrogen. They stimulate what's called the aromatase enzyme inside these fibroblasts, and the aromatase enzyme turns androgens, the testosterone-like compounds, into estrogen right there at the site. And it's been found that this one of these compounds, this PGE2, that is produced by those inflammatory cells, can increase the aromatase activity by 6 to 7 fold. So increasing that enzyme that makes the estrogen by 6 to 7 fold, if that is being produced. Cancer cells can also make something called glucocorticoids, which also stimulate aromatase. So basically, the factory starts producing its own chicken, so it can help make that chicken broth, and forgetting outsourcing it anymore. Okay, but what happens now aromatase inhibitors can reduce the estrogen also being produced by the cancer itself, by those fibroblasts, and so even their production of the estrogen itself might be declining. And so if you're a factory, what do you do if you don't have your chickens, if you're making chicken broth? Well, you start employing a chemist that makes some additive or some, chemical that tastes like chicken. Or, they throw more MSG in there or yeast. And that's what chicken broth companies do if you ever look at the ingredients. I mean, if you're at home and you're making chicken broth, you're using a lot of chicken in your chicken there. But if you look at the box stuff, some of them has MSG or natural flavors or yeast. Yeast extract is in a lot of boxed chicken broths. They find that there's hardly any chicken in the chicken broths that are being produced. But that's kind of what happens, is that what the cancer cells will do is they will upregulate those other things that crosstalk with the estrogen. I mentioned there's something called EGF. And then HER2. HER2 is a receptor on some cancer cells that stimulate growth. Insulin growth factor. And then there's just a whole bunch of other things. MMPs, they're called, and pathways that crosstalk with the estrogen to amplify the estrogen signaling. Just like MSG amplifies the chickeny flavor that's in the chicken broth, that little bit of chicken that might be in there. Yeast extracts that contain natural glutamates and monosodium glutamate in MSG to amplify that little bit of chicken that's in there. These compounds, this EGF, the HER2, the insulin growth, is all upregulated to amplify the estrogen signaling from that little bit of estrogen that still may be present, being supplied by those fibroblastic cells. Okay, so natural medicines, there are numerous natural medicines that can reduce these inflammatory compounds, decrease these amplifying pathways. So in essence, take away the things that the cancer cells are using to try to start making their own estrogen, and also taking away those additives and stuff that are used to amplify the estrogen signaling system. Take away extra amounts of HER2 or EGF or insulin growth factor. So that's what I want to get started on talking about. So there are these inducers that are released by the inflammatory cells, the cells that are surrounding these fibroblasts, the neutrophils and the M2 macrophages. They produce inflammatory cytokines. One or a compound that's an inflammatory compound is called PGE2, and one's called oncostatin M. And you can measure PGE2. I mentioned in a previous show that you can measure it in the urine, and you can even measure it in the blood. And they've done that in lots of clinical studies and found different things that can lower that. You can also measure something that is induced or increased when PGE2 is produced. It's called interleukin 10. Interleukin 10 can be measured in the blood, and if it starts to elevate, it's often a sign that PGE2 is being produced by those inflammatory cells. And so you want to do things to reduce interleukin 10. You can measure other inflammatory cytokines and compounds like interleukin 6 and something called oncostatin M. So basically, you don't want to see these inflammatory compounds high in the blood. It can, over time, lead to resistance to the aromatase inhibitors and tamoxifen. So you measure them, making sure that they are low, using natural things to do that. For example, in a journal, Neoplasma, just recently, 2014, they took 112 women with breast cancer, and they measured some of these inflammatory compounds, and they found that women that had elevated levels of these inflammatory compounds were more likely to have lymph node involvement and had more vascular blood vessel invasion and shorter survival. Why? Because it leads to more quicker resistance to these hormonal therapies when these inflammatory compounds are present. Okay, so let's start. First compound that can lower some of these inflammatory compounds is GLA. It's called GLA, which is a fatty acid that's found in numerous seeds from plants, such as borage oil, the borage plant, and from the black currant oil, and it's also found in evening primrose oil. But GLA from borage oil is the one that has been studied. And there's human studies and animal studies. But the animal study, like International Journal of Cancer in 2001, took mice with breast cancer, and they gave them just a control diet. Or then they took that control diet, and they added this fatty acid from borage called GLA. And then they added tamoxifen in another group, and then tamoxifen with the GLA, and found that the group that got the combined GLA with the tamoxifen had better results. The tamoxifen shrunk the cancer better than tamoxifen alone. And how did it work? It reduced PGE2. It reduced this inflammatory compound, which stimulates eventually the fibroblasts to make more estrogen. And by reducing that, the tamoxifen doesn't have to block as much of that estrogen. So that's how it helps. It's also been studied in women with breast cancer. International Journal of Cancer again, in the UK, it's been studied in 2000. They took 38 women with breast cancer, and they gave them tamoxifen with the GLA from the borage, or they just took a group and they just tamoxifen alone. The group that got the combined GLA with tamoxifen had a faster clinical response, and it reduced this compound called BCL2, which can increase when other inflammatory compounds are being produced. So it was an indirect way of measuring inflammation. So borage oil might be a very useful thing. Started either right at the beginning of aromatase inhibitor or tamoxifen, or after a woman's been on it for a while to help prevent resistance. Curcumin. Curcumin is a compound found in turmeric, that Indian spice turmeric. About 20% of that Indian spice contains this compound called curcumin. Don't get it confused with cumin. That's a different spice altogether. But turmeric has this compound called curcumin in it. And I've talked a lot about curcumin because there's lots of research being done on it. But they have shown that it inhibits inflammatory compounds. It affects this enzyme called COX-2. COX-2 is an enzyme that is upregulated in cancer cells and in those cells, those inflammatory cells. And COX-2 takes fat from the body, so any fat that you eat, and it converts it into things. And if you eat a lot of saturated fat and corn oil, vegetable oils, and dairy products from corn-fed animals and meats from corn-fed animals, then the COX-2 enzyme takes that corn oil, and that they call it omega-6 fat, and starts producing PGE2 from it. And that PGE2 then stimulates eventually the estrogen production. Well, curcumin fed to mice for 7 days. Then they did biopsies, found that it reduced the level of this COX-2 enzyme in the cells. So it helps prevent the expression of that. And it has been shown to then lower PGE2 production. Well, curcumin has been studied with the aromatase inhibitor letrozole, where they took it in Chinese Journal of Cancer in 2009. And this one was uterine cancer, which is an estrogen-sensitive cancer as well. So they gave the mice uterine cancer, and they combined it with letrozole, an aromatase inhibitor, curcumin with letrozole. And they found that the group that got the combined curcumin and letrozole, the tumors didn't grow as quickly. They all grew, but they didn't grow as quickly with the curcumin and the letrozole. 22% inhibition with letrozole alone after 8 weeks, 35% inhibition with curcumin plus letrozole. And so that one curcumin thing can help decrease PGE2. It also affects those amplifiers, those, like I've given you the analogy of the MSG and the yeast extracts, the things that amplify the signaling amplify the chicken flavor. But so there's these compounds, HER2 I mentioned, EGF, MMPs, all kinds of things, insulin growth factor that amplify the estrogen signaling. And if the cancer isn't able to make the estrogen that it needs and get the estrogen that it needs from fat tissue in the ovaries, well, then it will amplify these DOCs and these ports and these signaling pathways to help the estrogen work better. And curcumin's been shown to help affect those pathways as well. It reduces this HER2. The journal Evidence-Based Complementary and Alternative Medicine in 2012 fed animals curcumin and then in animals with breast cancer and measured HER2 expression and found that curcumin reduces HER2 expression. They do have drugs for that right now, but as far as I know, they're not being used right now to prevent aromatase inhibitor resistance. It's certainly in clinical trials, and they've already done studies, but it's not a regular thing that I've seen yet where they combine a drug, Herceptin, or they have some drugs, lapatinib, when aromatase inhibitors stop to working. But curcumin is readily available. It's over the counter, and it's showing evidence, at least in animals, that it might help prevent resistance from developing to aromatase inhibitors. And one thing it does is it decreases PGE2, and it also affects HER2, like this Herceptin compound does. It also affects other growth factors that amplify the estrogen signaling. One of those factors is called EGF. And they did a study in the International Journal of Cancer in 2008 and found that mice that were given curcumin had a significantly decreased level of EGF receptors. So that amplifier was also reduced. And then it also reduces another amplifier, so called MMP9. MMP9 is another amplifier, just like, okay, you got the yeast, you got the MSG, you got some other chemical that are added to chicken broth, all to amplify the chicken flavor. Breast cancer cells amplify HER2, amplify EGF receptors, amplify MMP9 expression, all these things to help amplify the estrogen signaling. Curcumin can affect HER2, it can affect EGF receptors, and it can affect MMP9, at least in animals when given orally. In a study in vivo in 2010, they gave breast cancer to mice, treated them with a specific form of curcumin called Mariva, and it reduced the expression of MMP9 when they tested the tumors and prevented the spread. All this led to better responses, curcumin causing tumor shrinkage and slowing cancer growth. So it's a well-researched product. Certainly more research needs to be done, but it's often well tolerated and widely available. Vitamin D is another one that has been shown to reduce this COX-2 enzyme, the enzyme that leads to production of PGE2. So COX-2 is that enzyme that's expressed in breast cancer tumors over time that converts that corn oil and those fatty acids into this PGE2, which leads to resistance. Well, they've done a study in the Anti-Cancer Research Journal in 2013 in Texas. They gave Women, this was a human study, 2,000 units of vitamin D for a month, vitamin D3, and found that COX-2 expression decreased, but only in the women that got the 2,000 units of vitamin D, not in the placebo group. And when they measured the fluid drained from the breast, they found less PGE2. It's been studied in vivo in animal studies to affect aromatase. In the journal Steroids, 2012, they gave vitamin D to animals, and they measured aromatase activity and found that it reduced aromatase activity, vitamin D. And it did it by reducing the level of PGE2. So vitamin D is a really important thing. A lot of people are deficient in it because we're not getting out inside in the sun. And when we do get out inside of the sun, we put in all that sunblock on that's blocking our production of vitamin D. Vitamin D is not found in too many foods. It is found in fatty fish like herring and sardines, salmon, which not too many people eat. And you have to eat a lot of those to get your daily requirements of vitamin D. Just like, say, 4 ounces of salmon might only have a couple hundred units of vitamin D. And a lot of people need 2,000 to 4,000 units of vitamin D a day, which we can get if we're out in the sun. But if you're inside, like me, working all day, you're not getting it. And so a vitamin D supplement is the best way to do that. But there's been research done that you measure vitamin D in the blood, a particular form of vitamin D called the 25 vitamin D, and you measure it in the Journal of Steroid Biochemistry and Molecular Biology, 2007. They found that women had the breast cancer risk was cut by half if their vitamin D blood level was at least over 50 versus those women that had very low levels of vitamin D, 13 and below. So 50% lower risk of getting breast cancer with a vitamin D level over 50 versus those that had really low levels under 13. So have your vitamin D level checked and you want it up around 50, which is usually achieved with between 2,000 and 4,000 units of vitamin D given orally, or getting more sun if you want to get it that way. But at least in the wintertime, you want to kind of stock up and take that, at least in Massachusetts here. All right, so that's vitamin D, and when I get back, we're going to talk about melatonin and some other herbal therapies. This is Cancer Concepts and Compliments. I'm your host, Dr. James Belanger.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hi, everyone. Welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger. Before the break, we were talking about how cancer cells can increase their production of inflammatory compounds like something called PGE2, which then induces the production of estrogen at the site of the cancer. So the cancer does not need to outsource the estrogen and get it from fat tissue or from ovaries. And then it will amplify this if their production of estrogen is being decreased by aromatase inhibitors and or tamoxifen. And then I was talking about how curcumin and borage oil or GLA from borage oil and vitamin D can reduce the production of PGE2 and thereby make some of these hormonal therapies work better, at least in animal studies. Well, adding to the list of other compounds that have been shown to reduce PGE2 and other inflammatory compounds, there's melatonin. Melatonin has been studied in the Breast Cancer Research Treatment Journal in 2012 to also suppress PGE2. But in addition to suppressing PGE2, it reduces inflammatory cytokines like TNF and IL-6, which are being produced in high amounts by those inflammatory cells. And then it's been shown to reduce aromatase production by those fibroblast cells so that they can't amplify the aromatase and try to overcome resistance to or create resistance to the aromatase inhibitors. Well, they've done a study in the Journal of the National Cancer Institute in 2005 where they took 438 women and they measured a metabolite, a breakdown product of melatonin, and found that women that had a high amount of that metabolite had a lower risk of invasive breast cancer, or 41% lower risk if they had a good high level of this melatonin breakdown product than women that didn't have that much. So it's a really important thing to measure melatonin, especially if if you're having trouble sleeping at all, to check the melatonin. I don't do this urine metabolite of melatonin. I'm not aware of its availability, but it's been found that the saliva melatonin follows along with this urine melatonin. So you can measure melatonin in the saliva, actually, and there's a lab called Pharmacin Labs in Wisconsin that does that, but there's numerous other labs that do it, and you can measure that, and if it's not at a good level, then consider taking melatonin. Or tryptophan is another product that helps increase melatonin. It gets turned into melatonin in the body when the light goes down. But getting rid of all the night lights and blocking the light so that if you have some neighbor that keeps their light on, anything that's going to reduce your melatonin. And do try to dim the lights at night and wind down, and that will help your body start producing its own melatonin. If you have lots of lights on late at night and then you just go off to bed, your body's not getting the signals that it needs to help start making that melatonin. And people that work the night shift too that are found to be at higher risk for getting cancers like breast cancer because of the disorderly melatonin release. So melatonin is really important, and it might affect this PGE2 and other inflammatory compounds. There's been a study done in the British Journal of Cancer in 1995 where they took 14 women with metastatic breast cancer that were progressing on tamoxifen. So the tamoxifen was no longer working for them, and they gave them melatonin at night, and 4 out of the 14 women started to have a response to the tamoxifen when they weren't having it before. 4 out of 14. And it lasted for an average of 8 months. And what they measured, they didn't measure PGE2, but they measured insulin growth factor. They found that was reduced. Insulin growth factor, you can add it to the list of amplifiers to the estrogen signaling system. So I've already mentioned HER2, EGF, MMP9, and now insulin growth factor. Insulin growth factor is a growth factor that will amplify the estrogen signaling if the estrogen signaling system is running low because of the hormone therapies. And that's a way that it overcomes the drugs. So that's like the MSG thing. So melatonin, that's another thing that can be measured. You can measure IGF in the blood, and you measure what's called the IGF binding protein. There's all kinds of research showing that you want what's called the IGF binding protein ratio to be low. So that there are basic tests that can be done at Quest Diagnostics and LabCorp. I measure in all my patients. If that thing is high, then melatonin might be one of many things that reduces that to take that growth factor away from the breast cancer cells so it can't amplify the estrogen. Selenium has been also shown to affect PGE2 and other amplifiers of the whole estrogen signaling, in particular the MMP2 amplifier. But not just any selenium, organic seleniums. Seleniums that are found in food, like Brazil nuts, you'll hear, are extremely rich in selenium. And they have a particular form of selenium called methylselenocysteine. Methylselenocysteine. It's found in Brazil nuts, it's found in porcini mushrooms, it's found in garlic, it's found in asparagus, and certainly you can get it in a pill form as well. And that form of selenium, not the what's called the sodium selenite form, the methylselenocysteine form has been shown to reduce aromatase expression in breast cancer cells. And in the journal Breast Cancer Research Treatment in 2009 in New Orleans, they gave animals breast cancer. They treated them with tamoxifen by itself or tamoxifen with methylselenocysteine, that organic form of selenium. And they measured the tumor size twice a week, and they found that the combination inhibited the tumor growth better than tamoxifen alone. And when they took the tumors out, they found increased cell death, pathways. They found that the cancer could not proliferate as well because it didn't have that estrogen as much, that the pathways that help it proliferate, help it grow, that was being taken away from it. They measured PGE2, found that selenium reduces PGE2 and the binding of it to its receptor. And then in other studies, they found that methylselenocysteine affects MMP, an amplifier to the estrogen pathway. So that's another thing. So it's a good thing to eat those foods and possibly taking a supplement. There's numerous companies that have that form of selenium, like Life Extension Foundation is a company that has that form of selenium available in a pill. Other forms of selenium might not do that, and that's what you might have heard some recent research done that sodium selenium is bad for prostate cancer, and it was the inorganic form, the sodium selenite form, which was being studied, and another form, selenomethionine. It's the methylselenocysteine is processed differently in the body, basically, and that's the one that's found in our food. We don't find sodium selenite in our food. The plants take the selenium from the soil and convert it into these organic compounds, adding things to the selenium molecule and make it better for our bodies. Okay, there's a couple other herbs that help with inflammation. One of them is called coptis. Coptis I mentioned before in another show that lowers something called interleukin-6. Interleukin-6, when it's elevated, is an inflammatory compound and also induces the expression of this aromatase. Well, coptis, or it's also called Chinese gold thread, it's very similar to golden seal, has been studied in the Biochemical Biophysical Research Communication Journal 2009 that it enhances the effectiveness of aromatase inhibitors and tamoxifen by downregulating those amplifying pathways, EGF, HER2, BCL2, and the COX-2 enzyme. So that's another useful thing. You can measure interleukin-6, you can measure MMPs and different things, and coptis might be a useful herbal treatment that needs more research. Oncostatin M is another inflammatory compound that induces the production of the estrogen. And boswellia is a very good herb for lowering oncostatin M. You can measure oncostatin M and interleukin-6 and things induced by oncostatin M in the blood. And boswellia is a useful herb. It's frankincense, frankincense and myrrh. Boswellia is frankincense, and it's very good at lowering inflammation. And in fact, there's actually a case report that's published in the Journal of Neuro-Oncology 2007, right in Greenwich, Connecticut, where this woman that had breast cancer that spread to her brain that was not improving on standard therapy added a boswellia supplement and had improvement in the brain. Boswellia does cross the blood-brain barrier, and so does estrogen and everything too, and it reduces inflammation in the brain and in the cells around the brain cancer, and so that's probably why it helped. It reduces oncostatin M. There are some other things. Aromatase inhibitors certainly are helpful. They cause some side effects, though. They lead to osteoporosis. A lot of women have joint pains from it, sometimes depression. And certainly more research needs to be done on some of these other techniques so that maybe we find a drug or some natural thing that is better tolerated than a lot of the aromatase inhibitors that doesn't cause these other side effects. The osteoporosis is something that can be dealt with. There's natural things from calcium, trace minerals, vitamin K, things that can be added to help support the bones. So I always put women on bone supportive therapies with the aromatase inhibitors. And joint pain, vitamin D actually reduces joint pains and glucosamine sulfates and things like that without affecting the aromatase inhibitors. But vitamin D actually makes aromatase inhibitors maybe work better, reduces some of the joint pain. But there are aromatase inhibitors found in natural compounds as well. And the two natural things that have been shown to act as aromatase inhibitors in vivo, like in animal models, are grapeseed extract and ginkgo. And both of those are very well tolerated. I don't see any adverse effects. Whether they work as good as aromatase inhibitors is not known. But they have been studied Cancer Research 2006, grapeseed extract was found to inhibit aromatase activity in breast cancer in animals and suppress the growth of breast cancer. And I use grapeseed extract all the time, and nobody complains of any side effects from it. But again, we don't know if it works as good as the drugs, but it's something that needs to be looked in more. And what's nice about grapeseed, it doesn't just affect aromatase, at least in the animal models, it affects some of those amplifiers, this MMP9. Ginkgo has been studied in the BMC Complementary and Alternative Medicine Journal 2013. They divided animals with breast cancer 4 groups and found that ginkgo enhances tamoxifen, and the way it works is it reduces aromatase activity and reduces estrogen. So we're running out of time, and so I'm going to finish up this discussion next week. We're going to talk some more about enhancing the effects of hormone therapies, and I'm going to focus a lot on dietary compounds, mushrooms, cabbage family vegetables, soy, sea vegetables. All these things can help with estrogen. And if I have time, I might touch on prostate cancer resistance, because prostate cancer, they're also using hormone therapies for that, not aromatase inhibitors, but other hormone therapies that lower testosterone. And there's a lot of pathways that are similar with the breast cancer that we can maybe start discussing. But we're going to focus a lot on diet next week. So I hope you enjoyed this show and found it useful. This is Cancer Concepts and Compliments, and I'm Dr. James Belanger.
Thank you for joining us this week. Cancer Concepts and Compliments with Dr. James Belanger can be heard live every Tuesday morning at 6 a.m. Pacific Time, 9 a.m. Eastern Time on the Voice America Health and Wellness Channel. We hope to see you next week for another show.